Early childhood is the time when children learn and grow more quickly than at any other time in their lives. Most children move from one normal stage of development to the next. But for some children, there are unrecognized difficulties. These are children with mental, physical, or emotional delays that will become more serious if not detected and treated during the important early years of life between birth and age 6. Unfortunately, subtle delays are hard to detect in infants and young children. As a result, too many of these children are not identified early, when intervention is generally most effective and least expensive. That's why the Denver 2 was developed. The Denver 2 is a simple and inexpensive test to screen children from birth to age 6 who have no apparent signs of developmental delays. It is the new version of the Denver Developmental Screening Test, which has been used to screen the development of more than 50 million children around the world since it was introduced in 1967. The Denver 2 was normed in 1989 on a sample of 2,096 Colorado children. It consists of 125 activities that are fun and interesting for children to do. Materials for testing are contained in a test kit. These are a red yarn pom-pom, raisins and a small glass bottle, a rattle, a bell, a tennis ball, a red pencil, a small doll with a feeding bottle, a plastic cup, and 10 colored blocks. Materials in the test kit have been carefully selected and were used in the standardization sample, so replacements must be duplicates of those in the kit. In addition to these materials, you'll need a lead pencil and blank sheets of paper for the child to draw with, and a blanket if you place babies on the floor. A watch is useful for timed items. 2 manuals accompany the Denver 2. The Denver 2 training manual contains detailed instructions for testing, scoring individual items, and interpretation of the test. The technical manual includes information about standardization of the Denver 2, how to train others to use it, and how to set up a community screening program. This is the Denver 2 test form. The form has lines at the top and bottom that show ages in months and years from birth to age 6. Each of the 125 test items is represented on the form by a bar that indicates the ages at which 25%, 50%, 75%, and 90% of children in the norming sample were able to do the individual items. For example, for the item Dress No Help, 25% of children in the norming sample dressed without help at 3 years. The hatch mark shows that 50% dressed themselves without help at 3.5 years. The left end of the shaded area shows that 75% dressed alone at 4 years, and the right end of the bar indicates that 90% of the children in the sample could do this at 4.5 years. Some of the items have a small R in blue on the left end. These indicate items that can be passed by parental report. Some have a footnote number on the left end. These refer to instructions on the back of the test form. The 125 items in the Denver 2 are arranged on the form in a manner similar to a growth chart, with items done at an earlier age on the lower left, and harder items going up to the right. Like the original DDST, the Denver 2 is arranged in 4 sectors: personal social, fine motor adaptive, language, and gross motor. Many more language items have been added, and some items have been altered or replaced to reflect the changing world in which children live. Now that we've had a look at the test materials and forms used in the Denver 2, let's look at the steps in administration. This will include preparing the child and caregiver, explaining the purpose of the test to the parent, correctly calculating the child's age, accurately drawing the age line, knowing the guidelines for the order of testing, scoring individual test items, and the number of test items to administer. To get the best response from the child and accurate responses from the parent, it's important to make them both comfortable. The child needs to be able to reach the test materials easily. Ideally, you want the child to be able to rest his or her arms on top of the table. A young child can sit on the parent's lap. If the child is still too low, ask the mother to use a folded blanket to raise the child. A child-sized table and chair are ideal for testing an older child, while a baby may be tested on a table or on a blanket on the floor. Once the child and parent are comfortably seated, explain the purpose of the Denver 2 to the parent.
Mr. Kettering, what we're doing here today is looking at Grant's current development. This is not an IQ test, and I won't expect Grant to do everything that I ask of him. While
you're doing this, put out a test item for the child to play with and watch to see what happens. Some parents may be anxious about the testing, so explain that the Denver 2 is used to see how the child's development compares with other children of the same age. Tell the parents that the Denver 2 is not an IQ test, and the child is not expected to do all the items. The third step is accurately calculating the child's age. To do this, write the date of testing by year, month, and day, and under it write the child's birth date, also by year, month, and day. In this example, the date of testing is May 10, 1990, and the child was born January 4th of 1990. So the child's age for testing is 4 months and 6 days. Let's look at another example. Here, the date of testing is May 10, 1990, and the child was born on June 14, 1989. Right away, you see the problem. You can't subtract 14 from 10. You have to borrow from the month column. For the purposes of the Denver 2, a month is considered to have 30 days and a year to have 12 months. So you borrow 30 days from the month column, leaving 4 months. Then you add 30 days and 10 days to get 40. Now you can subtract 14 from 40 to get 26 days. When you try to subtract the months, you have the same problem. You can't subtract 6 from 4, so you borrow 12 months from the year column, making the year 89. Add the 12 months to 4 months, and you have 16 months. Now you can subtract 6 from 16. This child's test age is 10 months, 26 days. Accurate calculation of the child's age is very important, so always check your result by asking the parent or caregiver the child's age. For children under 2 years of age, ask if the child was born early. If the child was born more than 2 weeks before the expected date of delivery, divide the number of weeks premature into months and days, using 4 weeks to a month and 7 days to a week. Then subtract from the calculated age. Remember, adjusting for prematurity only applies to children who were born more than 2 weeks prematurely and who are less than 2 years of age. Prematurity does not count for children over 2 years of age for purposes of the test. Here's an example of calculating the adjusted age for a young girl who was born 6 weeks early. Her date of birth is January 4th, 1989, and the date of testing with the Denver 2 is October 20th, 1990. To find her age for testing, do the age calculation as usual. It tells you that Gabrielle's chronological age is 1 year, 9 months, and 16 days. Next, translate 6 weeks prematurity into months and days. In this case, 6 weeks would become 1 month and 2 weeks, or 1 month and 14 days. Subtract these from Gabrielle's chronological age, and you find a test age of 1 year, 8 months, and 2 days. Accurate drawing of the age line is another important step. The age line is essential to interpretation of the Denver 2, as we will see later, so it should be drawn as accurately as possible and not rounded off. Use the marks at the top and bottom of the form as a guide. Mark the age at the top and bottom and use a straight edge to draw the age line. Write the date of testing at the top of the age line. Adjustments for prematurity should be noted at the top of the form in this manner. Each child is a little different, so you must be flexible when you administer the Denver 2. But there are some general guidelines that will help make that process smoother. In general, begin by talking with the parent about report items in the personal social sector while the child plays with test items and gets comfortable in the test setting.
Mrs. Spicer, let me ask you a question about her. Is she able to brush her own teeth?
No, I do brush them for her. I would never give her her own tube of toothpaste.
Okay, fine. So you haven't had the opportunity to do that yet.
Right.
Okay.
While you're talking with the parent, be watching the child's play to see what test items the child does spontaneously. Informal actions, even if you see them before or after formal testing, count as part of the screening. Follow the personal social report items with fine motor adaptive items that let children have successes without requiring them to talk.
Now, what I'd like you to do is I'd like you to draw a person for me, okay? Draw the best person you can, and you put it right here on the paper, okay? Go ahead.
Do the language items third, after the child has had a chance to become relaxed with you.
Nikita, I'm going to ask you some questions. I want you to listen carefully and answer me, okay? What do you do when you are cold?
I jacket on.
You put a jacket on, all righty?
Do the gross motor items last. This is because some children get very excited with the hopping and other gross motor activities and don't want to sit back down at the table to do quiet items.
There. Okay, now you do that. Jump right over that paper. Good for you. That was perfect.
In each sector, begin with 3 items that are completely to the left of the age line. These are items done by most children at an earlier age than the child being tested. The child probably will be able to do these items easily, which will increase his or her confidence and pleasure in doing the test.
One says meow.
Items that use the same materials in the test kit, such as the blocks, may all be done consecutively to save time. Knowing which item to do next to maintain the flow of the test session is something that comes with practice. So that the child isn't distracted, remove test items from the tabletop when you're done with them. A good way to do this is to keep the test kit in your lap, out of sight of the child. Next, let's look at how individual test items are scored. Write a score large enough to be clearly visible on the bar at the 50th percentile hatch mark for each item being tested. Score a P when the child passes an item, and an F when the child fails an item. The child may have up to 3 trials to perform an item before you score it a fail. If you do it more than 3 times, you may be teaching instead of screening. And score R when the child refuses to do an item. A refusal cannot be scored with report items. Score NO when the child has had no opportunity to try an item. A no opportunity score can only be used with report items. To minimize refusals, tell children to do the items. Don't ask if they can, or they may refuse.
Okay, now, Nikita, point to the longer line. That one? Okay.
If the child won't cooperate, you can ask the parent to administer an item. But if you do this, you must tell the parent exactly how to present it. At the end, check off the boxes on the front of the form that relate to the child's behavior, and ask the parent if the child's behavior during the test was typical.
Gina, was Matt's behavior today pretty typical for him?
Yes, it is.
Okay.
Any observations you have about the child or test may be recorded on the back of the form. New testers often wonder how many items to administer for each child. That will vary depending on the child's age and the purpose of screening. Let's look first at scoring when the goal is to identify children who are developmentally at risk. We have said that testing should begin with test items completely to the left of the age line so the child will have immediate successes. At least 3 easy items that the child can pass should be administered in each sector. If the child fails, refuses, or has had no opportunity to do any of these items, administer additional easy items until you have 3 consecutive passes to the left of the age line in each sector. Also, administer all items that the age line passes through. If you're short of time, you can stop at this point. However, if you want to get a picture of the child's strengths, continue testing to the right of the age line. Administer harder items until the child has 3 failures to the right of a pass in each sector. This will give you the child's ceiling. This child, for example, is average in the fine and gross motor areas, but is quite advanced in language and personal social skills. We've seen an overview of the Denver 2 and have discussed preparing the child and caregiver, explaining the purpose of the test, calculating a child's age, drawing the age line, knowing guidelines for the order of testing, scoring individual test items, and the number of test items to administer. At this point, you may wish to stop to review these topics in the Denver 2 training manual. Before you resume the tape, be sure you've carefully read directions for administration of specific items in the Denver 2 training manual. Each item must be done exactly as described in the manual, or you will not get valid test results. All you will get is your own subjective opinion. So be sure you are familiar with instructions on how to do the items before you continue this video program. Next, we will demonstrate several items from the Denver 2. As with actual testing, we'll begin with items in the personal social sector. First, let's watch the item Play Ball with Examiner.
Now roll it back. Roll it back. Thank you.
The child tossed the ball to the screener, so the item would be scored a pass. Rolling the ball with purpose to the screener would also be a pass.
Here it is. Woo! Get the ball. Roll the ball. Throw me the ball.
In this example, the child handed the ball to the screener, so this item would be scored a fail. Here's another personal social item. Dress, no help. To pass, the child must dress completely and correctly, knowing right from left and front from back, without help. The only help may be for tying shoelaces and buttoning or zipping the back of a dress.
Okay, Mrs. Stewart, tell me a little bit about how Lance is able to handle dressing.
Okay, well, he can pretty much dress himself, except he just can't tie his shoes. He can button his shirts, he can unbutton his shirts, he can put on his pants. He can't do belts yet, but pretty much the same.
I can do Bill.
You can? Oh, okay. Well, I didn't watch you.
He sounds like he's doing pretty good with that then.
Yes,
so
he is.
He can pull on his clothing and his pants?
Yes, he can.
Okay. And do you tie his shoes for him?
Yes, I do.
Okay.
This item would be scored a pass
All right,
because
Lance,
the
let's
child
go ahead.
dresses himself and only
Mark up
needs
other
help
things and
tying
stuff,
his shoes.
things you can do with
I
it.
can do one.
Let's look next at some items from the fine motor adaptive sector. Here's the item called Look for Yarn.
Why? Very nice.
Notice that the tester attracts the child's attention to the red yarn and then drops it out of sight. She does not move her hand or arm when she drops it. The child definitely looked to see where the yarn went, so this would be scored a pass. In contrast, this child did not follow the yarn with his eyes, so this item would be scored a fail. There are several items in the Denver 2 that require use of raisins or O-shaped cereal. One of these is rake raisin. Watch this demonstration. Notice that the tester made sure the piece of cereal was on a surface where it was clearly visible. She pointed to it to get the child's attention. The child purposefully picked up the cereal piece using a raking motion of her hand, so this item would be scored a pass. A second item using raisins or O-shaped cereal is the thumb finger grasp.
CJ, look.
An older child who picked up the raisin using her thumb and one finger would be a pass on this item. To pass the thumb wiggle, the child must be able to isolate the thumb movement from other finger and hand movements.
Denitra, watch now. I want you to do just what I do. Look. Now you do it. You do it just like I do it. That's very good.
This child could not wiggle just the thumb, so this item would be scored a fail.
Okay.
Let's look at another example.
Matt, wiggle your thumb for me. Like this. Very good.
Score this item a pass, because the child was able to move his thumb without moving any other fingers. Draw a person can be scored as either 3 or 6 body parts. Watch this demonstration.
I want you to draw something else for me, okay? Now, what I'd like you to do is I'd like you to draw a person for me, okay? Draw the best person you can, and you put it right here on the paper, okay? Go ahead. That's good. Are you finished? Oh, that's a very good picture. Can you tell me all the parts that you put on that picture?
His leg,
Mm-hmm.
and his eyes, and his eye, and his head.
That's a nice picture, Lance. Very, very good.
Score this as a pass for draw a person 3 parts. Let's look next at the item pick longer line. Notice that this item has a footnote number on the left end of the bar. This refers to instructions on the back of the form. In this case, 2 parallel lines that are shown to the child.
Matt, see these 2 lines? Point to the one that's longer. Okay. Now, Matt, point to the one that's longer. Okay. Now point to the one that's longer.
See how the tester was careful to present the lines vertically to the child and turn the paper upside down each time. She asked which line is longer, not which line is bigger. When the child could not point to the longer line 3 times in a row, the testing continued. The child was not able to point to the longer line 5 out of 6 tries, so this item would be scored as a fail. Let's look now at items from the language sector. Let's look next at the item called Turn to Rattling Sound. To administer this item, the tester asked the parent to hold the child so that they were facing each other. This could be on the parent's lap or the table. The tester then positioned herself behind the child, quietly put 1 block into the cup, and shook it gently, 6 to 12 inches from the child's ear, but out of the child's line of vision. This was repeated on the other side. The child turned toward the sound on both sides, which is required for a pass. The item turn to voice is administered in the same position as turn to rattling sound. Positioning herself behind the child, the tester comes to within 6 to 12 inches of either ear. She puts her hand between her mouth and the child so the child won't feel her breath, and she whispers the child's name several times.
Carolyn. Carolyn. Carolyn.
The child responded on both sides, so this is a pass. The doll in the test kit is used for the item Body Parts 6.
And where's the baby's hand? And where's the baby's foot? Yes. Show me the baby's mouth. Where's the baby's mouth? You like the baby? There, okay. And where's the baby's nose? Okay, and the eyes? Where are the eyes? Uh-huh. Where's the baby's hair? Show me the hair. Uh-huh.
The child was able to point to 6 body parts, so this item is a pass. No actions is another item with a footnote number. The tester will show the child the pictures on the back of the form.
Which one says meow? All right. And show me the one that talks. Okay. Which one barks? All right. And which one gallops? Very nice.
The child pointed to 4 pictures correctly, so he passes no actions. This also passes no 2 actions. For the item Count 5 blocks, the tester will begin by putting 8 blocks and a piece of blank paper on the table where the child can reach them. Watch.
All right, Lance, let's try this game now. I want to see how well you can count. I'd like you to put 5 of my blocks on the paper. Go ahead.
1, 2, 3, 4, 5.
That's very good. Now, Lance, tell me, how many blocks are there?
5.
This child passed because he placed 5 blocks on the paper and stated that there were 5 blocks. He did not need to count the blocks for the screener. Finally, let's look at some gross motor items. For pull to sit, the tester puts the child on her back, grasps the child's hands and wrists, and gently and slowly begins to pull her to a sitting position. She immediately sees head lag and feels a difference in the child's upper arm, shoulders, and neck movement as she pulls, and she stops pulling right away. Score this item a fail. Let's see that item again with another child. The child's head did not lag at any time. In fact, he actively pulled with the tester, using his shoulder and neck muscles. Score this a pass. To do kick the ball forward, the tester has the child stand up and places the ball about 6 inches in front of her. He tells the child how to kick it and may demonstrate it for her if necessary.
Let me kick it. See? Now put it there. You kick it. Give it a good kick. Here. Give it a good kick. There you go. Good girl.
This item would be scored a pass. Let's look at a second example.
Let me put it here for you, and you kick the ball. Kick it. Oh, okay, good kick.
This child didn't kick the ball, she pushed it. Holding on to a support, sliding or pushing the ball with the foot, stepping on it, or hitting the ball on the backswing do not count. This would be scored a fail. Here's a demonstration of the item throw ball overhand. Notice that the tester stands at least 3 feet from the child. She tells the child to throw the ball overhand, and she demonstrates it also.
That was a good throw, okay.
Despite having 3 tries, the child was not able to throw the ball overhand between the tester's knees and shoulders. Spiking the ball downward, as this child did, throwing it underhand, or throwing it away from you are all scored as fails. Let's see that item again with another child.
What I want you to do is I want you to throw the ball to me overhand. Okay? Here, take the ball. Now wait. Now throw me the ball. Good girl.
Score this item a pass. The child threw the ball overhand and within an arm's reach of the tester between his knees and head. It's okay for the ball to bounce if it's between your knees and head when it starts the downward arc of the bounce. Balance each foot is done while the child is standing away from all support. Watch as the tester shows the child how to balance on one foot. If he can balance 6 seconds or more on the first trial, there's no need for a repeat. If he can't, she'll give him up to 3 trials. She'll use a watch to record the longest time on each foot accurately. If you don't have a watch, count 1 1,000, 2 1,000, and so on. The longest time the child balanced on the left foot was 4 seconds. The longest time on the right was 5 seconds. The score for this item is the shortest of the 2 times, which was 4 seconds. So the child passes balance each foot 1, 2, 3, and 4 seconds. We have seen demonstrations of a number of items from the Denver 2. Remember, for the test to be valid, all items must be done exactly as specified in the Denver 2 training manual. So at this point you may wish to stop to review administration of the test items. Now that you're familiar with how the Denver 2 is administered, let's turn to how it is interpreted. The first step in interpreting individual test items is to see if any of them may indicate a potential problem in development. Do this by looking for delays and cautions on the scored test form. Delays can be seen quite easily by looking at failed or refused items and seeing where they are in relation to the age line. A delay is any failed or refused item that falls completely to the left of the age line. In such cases, 90% of children in the standardization sample could do the item at an age younger than the child being tested. Delays are marked by shading in the right end of the bar. To repeat, a delay is any failed or refused item that falls completely to the left of the age line. Mark delays by shading in the right end of the bar. Cautions are also found by examining the relation between the age line and failed or refused items. Cautions are failed or refused items where the age line runs on or between the 75th and 90th percentiles. In other words, 75% or more of the children in the standardization sample could do the item. Cautions are marked by writing a large C just to the right end of the bar. To repeat, cautions are failed or refused items where the age line runs on or between the 75th and 90th percentiles. They are marked by writing a large C just to the right end of the bar. Once cautions and delays have been marked, the overall test is interpreted as follows. A normal test is one where there are no delays and a maximum of one caution. With a normal test result, the child's development is assumed to be proceeding without problems, and the child should be screened again at the next routine interval. A suspect test is one where there are 2 or more cautions and/or 1 or more delays. This test is suspect because the child had 1 delay in the language area and 1 in the gross motor area. A different type of suspect test is one with 2 or more cautions and no delays. This test is also suspect because the child had 3 cautions in the fine motor adaptive area. Another test is suspect because the child had 1 delay in the fine motor adaptive sector and 2 cautions in the personal social sector. To repeat, a test is suspect if there are 2 or more cautions and/or 1 or more delays. When you get a suspect result, it is recommended that the child be rescreened in 1 to 2 weeks to rule out temporary problems such as fatigue or illness. If the result on retesting is still suspect, a referral decision should be determined by the clinical judgment of the supervisor based upon the profile of the test results, that is, which items are cautions and delays, the number of cautions and delays, the rate of past development, other clinical considerations such as clinical history and examination results, and the availability of referral resources. An untestable test result is one in which refused items would be delays or cautions had the child failed them. For example, this test has 3 refusals that are completely to the left of the age line and would be delays if they were scored as failures. This test would be considered suspect, and the child would be rescreened in 1. Next is a proficiency test for the Denver 2. Please watch each of the following test items and score them as if you were the tester.
Lisa, could I have you please sit him up on the table and turn him around facing you? Good boy. Nice job. Danny. Good boy. Good boy. Danny. Okay. Danielle. Danielle, look. 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 Good girl. Good girl. Let's see here. Danielle. Look. Look. Here it is. There it is. Good boy. Good boy. There it is.
Look at the baby. I want you to feed the baby. Give the baby her bottle.
Where's the kitty cat? Where's the kitty? Where's the kitty?
Kitty.
Show me the kitty. Is that the kitty? Good. Where's the doggy?
Doggo.
Okay. Where's the bird? Show me the bird, Gabby. Show me the bird. Where's the bird? Okay. And where's the man? Show me the man. Good.
Watch what I'm going to do with the ball. I'm going to kick the ball.
Yes.
Bring it back here. All right. Now, stand still. All right. Now, you kick the ball.
All right, Lance, let's go and see this time how well you can throw a ball. I want you to throw it overhand, like this. Do you see that? Okay. Throw me the ball overhand, okay?
Grant, look what I do. You do that. You do that. You make a thumbkin? You make a thumbkin? Look, let's see. Let's see that. Look. Dad can do it. See? You do it. You try it. Just like that. Just like that. Okay, Amy, now listen carefully. Put the block on the table. Good. Right. Now put the block under the table. Okay. Now put the block in front of me. Thank you. Now put the block behind me. Thank you, Amy.
Anthony, what do you do with a cup?
You drink.
Yeah. Let's put your hand out so we can see you. What is a chair used for?
You sit.
And what is a pencil used for?
You color.
Okay. Ready?
Ready.
Watch this. Do this.
This.
Okay. Here we go again. Stand right here. Okay. Watch this. Do this. Okay. Now let's do it with this foot. Ready?
Ready.
Do it with this one. Lift this one up.
You take that pencil. Now draw me a person. Draw a really good person for me.
What's this for? This eraser?
No, no eraser. Are you done with your picture? All done? Okay.
Okay. Now watch how I do it. There. Now you make one. Take one over here or here. It's all right.
Nikita, now listen carefully. Put 5 blocks on the paper.
One, two, three, 4, 5, 6.
How many blocks are on the paper?
1, 2, 3, 4, 5, 6.
6 blocks. Thank you.
Ready? Stand this way. Okay. Now this time, let's do it so that your heel touches your toe and your other heel touches your other toe, like this, and they get as close together as they can, like that.